documented terms. I've published books. I have equity interest in those companies. I get royalty payments for my books. The university has a conflict of interest process. I have statisticians who are blinded to group assignment. They prepare the report, submitted to the people that sponsor the research, and the Institutional Conflict of Interest Committee. In 2000, I became a patient. I had a history of visual dimming 13 years earlier. I had leg weakness, MRIs of my brain and spinal cord. There's one lesion in the spinal cord, one in the brain, oligobands in the spinal fluid. I was diagnosed with relapsed remitting MS. I, being a physician, sought out the best MS center in the country, took the newest drugs in 2000. That was Copaxone. I was 45 at the time, and then 2 years later, my neurologist told me about direct MS charity in Canada in Lorraine, Brunei. So after 20 years of being a low-fat vegetarian, I adopted the paleo diet, giving up all grains, legumes, and dairy. The next year, I needed a two-recline wheelchair. I was 48. I was told I had secondary progressive MS. I took mitoxantrone, which did not help. I took tizagravir, a new biologic, which did not help. I switched to Cellcept, a immunosuppressant given to transplant drugs. And then I began reading the basic science and decided that mitochondrial dysfunction drives disability in Parkinson's, Alzheimer's, ALS, Huntington's, and probably progressive MS. So I created a supplement cocktail to support my mitochondria, helped my fatigue a little bit, and I was super grateful, but I was still progressing. In 2007, I could not sit up. I was in a zero gravity chair, one at home, one at work. I was still mentally clear, still seeing patients, still on the Institutional Review Board, reviewing research for safety. I was introduced to a study using electrical stimulation of muscles. I asked my physical therapist if we could add that to my regimen, which we did. I discovered the Institute for Functional Medicine. They had a course on neuroprotection, which I took, and learned more about chemistry. It had a longer list of supplements for my mitochondria. Then I had a really big aha, and I laugh at myself now. I redesigned my paleo diet to get more of these nutrients I was taking in supplement form from my food. And in doing that, the magic really happened. My fatigue remarkably reduced, my mental clarity improved. My physical therapist said, you're definitely stronger, you advanced some exercises. And 3 months later, I was beginning to walk again in the hospital. And in May, for the first time in 6 years, I started biking around the block. And then in October, my spouse had me sign up for the Courage Ride, which is 18.5 miles. I did that. And that really fundamentally changed how I thought about disease and health. My chief of staff at the VA hospital, my chief of medicine at the University of Iowa, encouraged me and got me the mentors to learn how to do clinical trials. And we did a safety and feasibility study using the protocols that I used for my own recovery with others with secondary and primary progressive MS. And it's the same intervention. The diet was 3 cups of leafy greens, 3 cups of deeply colored vegetables and berries, 3 cups of sulfur-rich cabbage, onion, mushroom family vegetables. We encourage grass-fed meats, organ meat, liver once a week, and wild fish. We taught people how to do mantra-based meditation. We taught them mat exercises and gave them devices and supplies to do electrical stimulation of muscles. This is an example of the meals, and we had to do an analysis of the diet since it was so restrictive, because we took out gluten, dairy, and eggs. And the maroon is the average American diet, women age 50 to 70. And the blue was my diet on a 3-day, 24-hour recall. So I was given permission to do the study. At baseline, the average recipient had 1.5 servings of vegetables, 5 servings of gluten, dairy, and eggs. They remarkably changed their diet and sustained that change over the study period. Now these folks, when they enrolled, were baseline disability was between cane and walker, so they're really quite seriously disabled. We got them exercising, and gradually they increased the amount of exercise. They could do additional electrical stimulation of muscles passively, which you see that they also increased. What I'm showing you here is the decline in fatigue severity. The clinical significance there is 0.45. The scale goes from 7, total fatigue in every aspect of life, to 1, no fatigue. The fatigue reduction was 2.38 overall over 12 months. The general health and energy improved over the 12 months, 14 to 17 points, and their clinical significance is 5. So that's a fairly large improvement in quality of life and reduction in fatigue severity. Lipids improved, body mass index goes down, total cholesterol goes down, the triglyceride HDL ratio goes down, which reflects improved insulin sensitivity, and HDL improves, so their metabolic health improves overall. Here we're showing anxiety goes down, depression goes down. That's the anxiety index, depression index. Then we have measures of verbal reasoning and nonverbal reasoning, and that improves over 12 months. And you expect with progressive MS to have worsening anxiety, worsening depression, and worsening cognition over the year. Here, the secondary progressive MS, it took this subject 127 seconds to stand, walk 8 feet, turn around, come back to the chair and sit down. At 12 months, it drops down to 41 seconds. Her fatigue has gone from 5.6 to 4.4. Subject 17, who has primary progressive, she needs 2 canes. It takes her 21 seconds. She has really profound fatigue at 6.7. In 3 months, she does remarkably well without canes. She's down to 17.6 seconds, and her fatigue is remarkably improved from 6.7 to 4.9. 11 at 3 months. Her baseline is 14.9. At 3 months, it comes down to 8.6. And her fatigue has gone from 5.3 to 4.1. And here she is jumping, and she can jog at 6 months. And here is some videos. If you want to get copies of my papers and the videos, you can go to terrywahls.com. If you watch her feet, you'll see that she has a hard time picking up her toes and bringing her leg forward, so she has weak psoas and weak tibia anterioris. We're worried enough that we're sort of chasing her with a chair in case she needs to just sit down. Remember, it took her 127 seconds to walk the 8 feet, turn around, and come back. And then we'll have her here at 9 months. You can see her improvement. And this is so it takes 9 months for improvements to show up. She stands much more fluidly. You can see she's swinging her legs more fluidly. She's certainly walking with more confidence. Then subject 11, at baseline, you see her stand. She uses the cane. So a little bit slower. At 3 months, now if you look at her feet, she's in Birkenstocks and her sandals. Her gait is almost normal. And at 11 months, you can see that she's able to jog. Subject 14 needs 2 canes, is quite stiff and spastic. And then at month 9, he's a bit more fluid. And then here he is without any canes. Here's another person with primary progressive, quite stiff. And at 3 months, she's more fluid, needs only 1 cane. And here she is able to do this without any canes. We have adults with significant fatigue, relapsing remitting MS. They come in, get baseline assessments, eat their usual diet, get repeat assessments. Then we randomize them, train them on either the low-fat swank diet or the modified Terry Wahls diet. We get 5 support calls with a dietitian. They come back in 12 weeks, repeat assessments, and then they continue without support calls, and will return in another 12 weeks. So we have 24 weeks of observation. We have control variables, so we do analysis in a general linear mixed models for analysis. And what we show is the primary outcome, the fatigue severity scale was improved for both Swank and Wahls. When we look at secondary outcomes, and there's no difference at 12 and 24 weeks. The modified fatigue impact scale, a little more sensitive. Wahls is a bit better at 12 weeks, but statistically not different than Swank at 24 weeks. Wahls is significantly more improved than Swank. For the MS quality of life, Wahls is better than Swank at 12 and further improved at 24 weeks. Swank does improve compared to the observation period at 12 and 24 weeks. The MS quality of life, Wahls is improved at 12 and at 24. Swank improves at 24 weeks. And there's significantly difference between Wahls and Swank. The 6-minute walk test, which is a measure of how far you can walk, there's no difference for Wahls or Swank. And we told people to not add an exercise program during the intervention period unless their physicians had prescribed it specifically. But super interesting, at 24 weeks, the Wahls group significantly improves their walking endurance. But statistically, the p-value is 0.08, so it's a trend, but not statistically different than Swank. The single-digit modalities test, which is a measure of working memory, Swank is better than Wahls at 12 weeks, but statistically not different, it's 0.08. And at 24 weeks, Wahls and Swank are equivalent. The message I give my patients is that both these diets are helpful. Wahls is more helpful than Swank for some, but not all of the measures. We did a secondary analysis of the WAIS trial data, which combines the 9-hole pegboard, measure of hand, 20-foot walk test, measure of walking speed, single-digit modalities, measure of thinking. We looked at observation period and 24 weeks of intervention. What we saw is that Swank improved at 12 weeks, further improved at 24 weeks. Wahls did not change at 12 weeks, but did improve significantly at 24 weeks. The changes were mediated by fatigue. So changing the diet leads to improvements in measurable disability. Then we have a remote diet and lifestyle non-inferiority study, quasi-experimental, which means people newly diagnosed with clinical isolated syndrome or relapsed remitting MS who are offered DMTs could choose to decline DMTs and get trained on the modified paleo diet, a walking program, and a breathing meditation, or do standard DMT use. And what we saw, then we compared fatigue, quality of life, mood, and cognition. And the question was the health behaviors not inferior to standard of care? And what we saw was that it was not worse than standard of care for fatigue, for headaches, depression, anxiety, quality of life, and cognition. Then we have an analysis of an online wellness course. There are 5 modules, multiple lessons within each module. That's web-based. People got access to the course immediately, or they waited 12 weeks and then got access to the course. And so we compare the intervention to the control group. You could get the course at terrywahls.com/AIM. There's a conflict of interest management in place. We saw a significant improvement in physical health, quality of life, and significant reduction in fatigue. So access to the AIM course was associated with improved quality of life and fatigue. We have new courses, new populations, so if you have friends or colleagues, we have a survey link and for fibromyalgia, for long COVID, for cancer in remission, that has persisting fatigue. We did a network meta-analysis in 2021. You have to have definitive MS, patient-reported outcomes of fatigue or quality of life, and at least a 4-week intervention. 12 studies, 8 different diets, 608 participants, low fat, Mediterranean, ketogenic, anti-inflammatory, paleolithic, fasting, calorie restriction, and usual diet. For fatigue, paleo, low fat, Mediterranean were effective, paleo being 40% more effective than low fat or Mediterranean. For quality of life, physical quality of life, paleo and Mediterranean were most effective, paleo being more than twice as effective as Mediterranean. For quality of life, paleo is more than twice as effective as Mediterranean. Again, we have a patient registry, easy to send your patients to terrywahls.com/trials to get into the patient registry, or the virtual studies for fibromyalgia, long COVID, cancer remission. There's a documentary about my healing story at defyingaloddsmovie.com. Follow me at Terry Wahls for Facebook, Twitter, at Dr. Terry Wahls, on Instagram to see what I'm eating and doing. It's lots of fun. You can get a one-page summary of the diet at terrywahls.com/diet. And if I could figure out how to stop my share, I would do that.